we place these kids and we leave them, and we say to everyone, oh, he's broken, he's so hard, he's not going to get it together, let's leave him here. And that's how they're feeling. They're feeling left out and alone.
I see a more powerful and strength-based approach to reframing the narrative around mental health, with that strong focus on well-being, a strong focus on wellness components, and bringing in holistic practices. And by holistic, meaning like the whole family, and a whole family-centered approach, that we're not just person-centered, but family-centered as well, that we are ensuring that families are connected to their basic life needs. We're oftentimes going into approaches with young people and their families without first pausing and looking at all of the other life domains that can be impacted, and additional complex layers to addressing behavioral health needs and their well-being.
Once the system captures you, like, it feels like you're captured, and it's extremely hard to get out. Like I said, they give you that shovel, let you dig real deep, then they throw that pile of dirt over you, and it's really hard to climb back up.
When we say that youth in placement have to be there because of their behavioral health needs, we're really stigmatizing behavioral health and mental health and well-being, because we're saying that your needs mean that a family setting just isn't possible. And I believe, from my own perspective, that with the right amount of supports, training, and resources, that all youth really can be home in a family setting and supported within their own communities, and not have to be in congregate care.
There's a real lack of understanding, again, at why young people are demonstrating the behaviors that they're demonstrating, or showing the things that they're showing, and grounding that in their life experiences. I always say there's mental health challenges, and then there's an expectable reaction to your life circumstances, right? And I think so much of what we see from young people that gets labeled as problem behaviors is an understandable reaction to having adults be profoundly untrustworthy for much of your life.
To be more trauma informed, one of the ways of doing that is really intentionally thinking differently about how we talk about the work and how we talk about the children who are receiving services. So that shift in language, we talk about children, youth, young adults, rather than clients, cases, and consumers, and the language of treatment versus placement. I think it's important to note that much of the work that's been done within our community provider agencies, both congregate settings and our community-based settings, is the use of non-stigmatizing language. We know that reduces trauma or repeat trauma, and that it improves outcomes for care.
I think there's a tendency, again, when we talk about mental health, to talk about disease, to talk about illness, to talk about deficits, right? And what I really appreciate about the healing framework is it's sort of a totally different mindset that shifts us to thinking about what you've come through, what you've had to do as a result, and then how do we move forward now if that's no longer serving you.
Including people with lived experience, including young people in the solutions, really has made a difference in their involvement, their investment. The outcomes, I think, are better because ultimately the services are custom built for the communities where people live and work.
If we don't start believing in these youth, if we don't start listening to what they have to say, then we might as well continue, to be in the same situation that we're in today. these young adults are our future, and we need to take heed to what they're saying and at least give them an opportunity to express themselves, because what they say is important.
Well, I think first and foremost, young people want to be seen and heard and not diagnosed and picked apart. So it's really important for mental health professionals who work with the child welfare population to begin with alliance building and then understand the family systems nature of this work. If you only treat young people, you locate the problem in young people, and young people are not the problem. It's what's happened to them and the relationships that they live in that need to be treated, not them. They're not broken, they're beautiful.